young cardiologist Elizaveta Romanova began her morning rounds in the intensive care unit of a major city hospital. The day started as usual, with careful monitoring of patients' conditions, coordination with nurses, and preparation for scheduled diagnostic procedures. The corridors buzzed quietly with the hum of monitors and the occasional beep of ventilators, creating a background rhythm that had become familiar over her years of practice. She moved from bedside to bedside, reviewing charts, adjusting medication schedules, and ensuring that every patient's vitals were within safe parameters. In the late afternoon, the emergency department called with a new patient, and by evening, a middle-aged man named Alexei Sokolov was admitted. He suffered from a rare vascular disorder characterized by acute coronary spasms and unstable blood flow. On arrival, he appeared outwardly calm, his face betraying little distress, but the lab results painted a far more urgent picture. Inflammatory markers were elevated, cardiac stress indicators were high, and preliminary scans suggested that his heart was under severe strain.
Elizaveta felt a growing sense of unease as she reviewed the readings. The patient's external calm did not align with the internal turbulence shown by the monitors. His heart demonstrated unpredictable rhythms, and his blood pressure fluctuated in subtle but concerning patterns. Each measurement demanded immediate attention, and the potential for rapid deterioration loomed over the team.
The medical staff quickly mobilized, preparing for emergency intervention to stabilize Alexei and prevent catastrophic complications. Equipment was checked, medications prepared, and protocols reviewed with meticulous care. Every movement was deliberate. Every decision required precision. Elizaveta sensed that this case carried an unusual weight, a hidden complexity that extended beyond the typical manifestations of his condition. The tension in the unit grew as the team understood that each moment was critical and that the patient's survival depended on their skill, vigilance, and the ability to anticipate complications that might arise at any second.
The atmosphere in the intensive care unit was charged with urgency and focus. Nurses adjusted monitors and intravenous lines. The on-call cardiologist consulted with rapid exchanges of information, and Elizaveta coordinated each step with steady determination. Though outwardly routine, the evening had taken on an air of unpredictability, a silent warning that this patient's condition might challenge every expectation and demand a level of medical intuition and responsiveness beyond the ordinary.
The preparation for the procedure was tense and meticulous. Elizaveta and her team worked with focused precision, setting up monitors, calibrating equipment, and preparing the necessary medications. Dosages of anesthesia were carefully calculated, taking into account Alexei's rare vascular condition and the unpredictable nature of his coronary spasms. Every instrument was checked, lines were secured, and the environment was maintained in strict adherence to sterile protocol. The atmosphere in the operating room was charged with anticipation, each member of the team aware that the patient's condition demanded absolute accuracy and constant vigilance. As the procedure commenced, Alexei exhibited an unusual response to the administered medications. Despite receiving standard doses of anesthesia, he retained partial awareness of the surgical manipulations. His pulse and blood pressure remained within expected ranges, but subtle fluctuations in cardiac rhythms and vascular readings created a contradictory picture that unsettled the team. The monitors displayed data that did not align with conventional expectations, suggesting that the patient's physiological reactions were behaving outside typical medical parameters. Alexei's awareness seemed to extend beyond the limitations of his anesthetized body. He appeared to observe the operation from an external perspective, noticing minute changes in tissue structures, the positioning of surgical instruments, and the responses of his own body to the ongoing interventions. Each movement by the surgeons was mirrored by predictive assessments from the patient, a phenomenon that simultaneously provoked concern and fascination among the medical staff. The team experienced a growing sense of tension and awe. The operation demanded not only technical skill but also constant adaptability, as Alexei's unusual responses forced reconsideration of standard protocols. The interplay between his apparent consciousness and the clinical procedures created an unprecedented situation. Every incision, every adjustment, every pharmacological intervention was accompanied by a silent dialogue with the patient's extraordinary perception, revealing a state that challenged the boundaries of conventional medical understanding. Elizaveta felt both pressure and intrigue as the procedure progressed. The combination of precise surgical technique, vigilant monitoring, and the enigmatic awareness exhibited by Alexei demanded an elevated level of concentration. The operating room, typically a controlled environment of predictable responses, had transformed into a space of profound uncertainty, where human perception and medical science intersected in a way that was as unsettling as it was remarkable. Each moment underscored the delicate balance between intervention and observation, highlighting the uniqueness of the patient's condition and the extraordinary demands on the surgical team. As the procedure progressed, Alexei began demonstrating an uncanny ability to anticipate the consequences of the surgeon's actions. He identified areas of tissue that were most vulnerable to damage and predicted how his body would respond to each tool, each incision, and each administered drug. His observations were precise, remarkably detailed, and consistently accurate, leaving the medical team astonished. Despite having no formal medical training, he employed terminology and concepts that aligned with professional surgical knowledge, suggesting an extraordinary cognitive capacity operating independently of his physical body. The surgical team repeatedly verified Alexei's assessments and found them to match perfectly with the physiological responses they observed. Each prediction he made about vascular reactions, tissue fragility, and procedural risks corresponded with real-time events on the monitors. This phenomenon challenged every assumption they had about consciousness and the limitations of the human mind, creating a mixture of awe, confusion, and cautious excitement in the operating room. Elizaveta felt a profound internal conflict. Standard medical protocols demanded reliance on established procedures and empirical data, yet Alexei's extraordinary awareness offered guidance that surpassed conventional understanding. She wrestled with the ethical and professional implications of acting on a patient's externalized consciousness while the operation continued, aware that each choice carried life or death consequences. Every movement during the surgery now carried a dual weight: the technical precision required to perform the operation and the careful consideration of Alexei's input. His capacity to perceive and anticipate outcomes elevated the stakes, demanding heightened focus, coordination, and adaptability from the entire team. The operating room transformed into a space where human skill intersected with an inexplicable phenomenon, a live experiment in understanding consciousness beyond the physical limitations of the body. As minutes stretched into hours, it became increasingly clear that Alexei's mind was accessing information unreachable through ordinary perception. The surgeons adjusted their techniques in real time, guided by his insights, and the usual rhythms of a controlled operation were replaced by a dynamic interplay between medical expertise and the patient's extraordinary awareness. Each successful maneuver reinforced the dual reality of the moment, a life-saving operation unfolding alongside the revelation of a phenomenon that defied conventional medical explanation. During the course of the procedure, unexpected complications began to emerge. Bleeding intensified in previously stable areas, and vascular spasms grew more pronounced, creating irregular fluctuations in blood flow.
The heart displayed intermittent instability, reacting unpredictably to both the surgical manipulations and administered medications. Each monitor reading suggested a delicate balance, teetering on the edge of crisis, forcing the team to remain hyper-aware and reactive to even the slightest change. Despite the escalating complications, Alexei maintained an extraordinary level of awareness, observing the unfolding events as if from outside his own body. He directed the surgeons toward the most effective interventions, anticipating which maneuvers would stabilize circulation and which could exacerbate the situation. His guidance, precise and timely, enabled the team to prevent potentially catastrophic outcomes. But the tension in the operating room was palpable. Every second carried immense weight, each decision a potential difference between life and death. Elizaveta experienced a mounting inner conflict, torn between adhering strictly to established protocols and integrating the unprecedented insights Alexei provided. The conventional rhythms of surgery, measured, controlled, predictable, were replaced by a dynamic interplay of medical skill and the patient's exceptional perception. Her focus sharpened, yet uncertainty lingered. The usual sense of authority in the operating theater was subtly eroded by the reality that part of the procedure's success now relied on input from a consciousness externalized from the physical body. The atmosphere of the room shifted. The hum of machines and the beeping of monitors, once familiar and reassuring, now underscored the unpredictability of the situation. Medical staff moved with cautious deliberation, attuned not only to the patient's physiological signals, but also to the extraordinary phenomenon guiding their actions. Each stabilization achieved was met with relief tempered by the recognition that they were witnessing an unprecedented interaction between human consciousness and the physical course of surgery. As the operation continued, the line between patient and practitioner blurred. Alexei's awareness effectively became a part of the surgical process, offering an invisible layer of observation and anticipation that influenced every decision. This dual reality, medical procedure intertwined with extraordinary consciousness, transformed the operation into a delicate experiment in human cognition, perception, and the limits of medical intervention, leaving the team in awe of what they were witnessing, while acutely conscious of the life at stake. As the procedure approached its final stages, Alexei's physiological indicators began to fluctuate. Blood pressure dropped, heart rate accelerated, and the extraordinary detachment of his consciousness gradually subsided. Elizaveta sensed a subtle shift. The patient's awareness, once observing from beyond his body, returned fully to the experience of his own physical sensations. The room's energy transformed from tense vigilance to a fragile anticipation of stability. Through meticulous intervention guided by both surgical expertise and Alexei's prior insights, the team successfully controlled the bleeding. Vascular spasms were mitigated and the heart's rhythm stabilized. Each corrective measure reinforced the precarious balance, and eventually the immediate threat to life was averted. The operation concluded with the patient alive and in a stable condition, a testament to both skill and extraordinary circumstance. The surgical team experienced a complex mixture of relief, awe, and confusion. The phenomenon they had witnessed, consciousness operating independently of the physical body, defied all prior medical understanding. What had initially seemed like a standard critical procedure had become an encounter with an uncharted dimension of human perception. Elizaveta, in particular, felt the boundaries of medical knowledge and ethical responsibility shift before her eyes. The experience challenged conventional assumptions about patient awareness, procedural authority, and the relationship between mind and body. The realization that consciousness could influence outcomes from beyond physical limitations left an indelible impression on the team, fundamentally altering their understanding of human potential and the ethical framework within which they practiced.
By the time the last instruments were cleared and monitors stabilized, a quiet reflection settled over the room. The life they had fought to save had been preserved, yet the lesson extended beyond survival. It was an encounter with the unexpected, a moment where human skill intersected with the mysteries of awareness, leaving the entire medical team to reconsider the very nature of consciousness and the hidden capacities of the mind. Following the surgery, Alexei gradually regained full physical stability. His vital signs normalized, and his body responded to routine care without complication. Remarkably, he retained no memory of the extraordinary observations and guidance he had provided while seemingly detached from his own body. In the days and weeks after the procedure, he returned to his normal life, unaware of the events that had unfolded during the critical operation. Elizaveta, however, felt a profound and lasting psychological impact. The experience had challenged her foundational understanding of human consciousness, revealing limitations in traditional medical knowledge. She became intensely curious about the intersection of mind and body, exploring theories of consciousness, altered perception, and the potential for awareness to operate independently of physical mechanisms. Her reflections led her to question whether Alexia's case was a singular anomaly or part of a wider, unrecognized phenomenon in critical care and neurology. In the intensive care unit, Elizaveta approached patient monitoring with heightened vigilance. She analyzed subtle physiological patterns, reassessed anesthesia protocols, and remained acutely attentive to any indicators of unexpected cognitive activity. Her methods incorporated a cautious openness to phenomena that had previously seemed impossible, balancing standard medical protocols with insights gained from the operation. The event prompted Elizaveta to engage in extensive research, reviewing medical literature, consulting colleagues, and participating in interdisciplinary studies on consciousness, neurophysiology, and mind-body interactions. She examined the ethical implications of patients' autonomy, awareness during sedation, and the potential for the human mind to influence physiological responses beyond current understanding. The experience reshaped her professional philosophy. Each patient encounter became a study in both physiological and cognitive nuance, and her approach to care was marked by patience, observation, and ethical deliberation. The case opened new avenues for inquiry into the nature of human consciousness, its autonomy, and its potential impact on the physical state of the body. For Elizaveta, the lessons of that extraordinary operation extended far beyond clinical success, illuminating unexplored horizons in the science of mind and the ethics of medical practice.